The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. We're all laughing because it's so cold outside and it's so cold and it's warm in here, isn't it? Except we're all in our jackets.
Baby's getting cold outside.
That's right. Oh, baby, it's cold outside.
Nadelchda, dobre utro. It's very cold. It's important because with the holidays, the kind of thing that we should be doing. You say you were talking before we went on the air. You're going to Miami to visit, family and friends, and lots of time when we are traveling during the holidays, we end up in emergency rooms. And the reason we end up in emergency room is that during the holidays, especially as we age, it's like somebody trying to go into the Olympics without training. The chances of getting hurt is so much higher than the person that trained that can still get hurt, right? But less chance of getting hurt because you have trained for the Olympics. During the holiday, we tend to do more than what we are used to. Even if we, if we are that couch potato, and your husband or wife or sister or brother or kids drag you and say, come on, let's go, we're going to have this big party. And, of course, they want grandpa to get up and dance, and they want to do this, and they want to talk, and, all of that can be strenuous on the heart and, the entire system. And, a lot of people during the holidays end up getting sick and going to an emergency room with congestive heart failure, heart attack, a stroke, and all those things.
Yeah, but wait a minute. Let's go back to the flu. I thought you were going to go through the flu here. Because if people didn't go to you to get a flu shot, it serves them right. Sorry.
Right. People take risk. There are people out there that will take risk and play Russian roulette. And there are many people that will take those kind of risk. And that's one thing. But the other thing is, who is at risk of getting sick? And let's go through the list of people who are at risk. If you take blood pressure medication and you have a tendency of taking your blood pressure medication always at night, but you're going to go out that night and you are not bringing your blood pressure medication, or if you take a water pill and you always take it in the morning, but you decided that because you're going to go out and you are taking 2 or 3 water pills, and sometimes you get some capsules that have 2 water pills in one. So if you decided, well, we're going to go out, so I'm not going to take my water pill because I don't want to be going to the bathroom every 5 minutes, so I'm just going to skip it. So and then you go out, and then the people who you are spending time with, they don't know that you have heart condition. They might give you something that is really salty. And now you load yourself with all this salt. So, you basically, like you say, we are asking for it. And, we go, I want, our audience out there to enjoy this times and the beautiful weather that we are having, and enjoy family and stay away from emergency rooms. And we are going to be open 6 days.
I was just going to say, you're open on Saturday.
Yeah, we are going
we don't want people to get sick, right?
We don't want people to get sick. And, I had a captain of a boat that is traveling to South America. And his trip is not until next Wednesday. They flying to Chile, and then from Chile they doing the cruise in South America. And he say, I just had this little cold, just give me something. And I said, well, let me know about you. I don't know you. I don't have any allergy. Just, I just need something for the call, like I said, you sound just like a captain, So he laughed and he sort of got more relaxed. And I said, tell me about your history. So I said, well, I guess, I can tell you that in 1990, whatever, I have endocarditis. When I have the endocarditis, it's inflammation of the inner part of your heart. That's very serious. So I sat down when he said endocarditis. I said, wow. I sat down. So I said, okay, did they do surgery? He said, yeah, they tried to replace my valve in the heart, but they couldn't because of the inflammation and all that. So they just couldn't replace it. So they took it out. They couldn't put anything in its place. And I said, okay. So I'm listening to the story. So I went outside to the wife and I said, for now, we might have to put that trip on hold. The guy is having a fever and very active. He's very active.
And he thought he had a cold.
Yeah, he had a fever of 100 and 100.8, and he'd been having a fever. He said for 2 or 3 days. He's trying to be a macho man, and my wife arranged all this trip, and I cannot cancel on her. And I said, So I got them together. I said, listen, what is more important for you to end up in South America, in some clinic where you need antibiotic and they don't have it, and they're going to tell you, I'm pointing to the wife, and they're going to tell you, go out in the street and buy this antibiotic, and you're going to tell me you don't speak the language, and, it's going to be horrible. You can lose your husband there. So I'll be honest, we'll try to, and he's coming today for, I'm injecting him with antibiotic. I'm going full steam ahead. I said, what you have might be a simple call to somebody else, but what you have can kill you. So we're going to be super aggressive, and I'm going to do my best, everything in my power to get you better. And I told him, by Monday, we will make a decision if we can continue with that trip or not. And she goes, in a funny way, she understood the seriousness. And she said, I guess I'll become your patient, and you're gonna treat me for depression.
Right. Yeah. Depression, right.
So,
right. Well.
So don't write things off. They did the right thing. They came right in. They got taken care of. And if they would not have done that, all of us, we don't have to be physicians and nurses. Just think of the catastrophe of what this man could have gone through. And his poor wife in South America, stranded there, without understanding the language. And, it doesn't have to be out of the country. It can be a trip, 3 houses away from your house. And what I want people to know that during the holidays, there are certain things that you need to do. You need to make sure you take your medication. I don't care if you think you're going to go to the bathroom more than often, which you are not. But at least if by mistake or what have you, they give you something that you are not supposed to have, something too salty, or what have you, at least your body is going to be able to handle that much better than not taking your medication. And some of the people that are at higher risk, guess who?
I know.
People that don't take. No, you don't know. Guess who? People that take medication as needed. Sometimes you have those people out there that they
as needed.
As needed. They have a water pill, and they say, "Oh, I have this water pill, but I only take it if my ankles swell up. Then I don't take it."
Oh, really?
Yeah, there are many people out there like
as
that.
Needed.
Which is okay. I mean, it's okay. I have some patients. I say, listen, if your ankles swell up, you can take that water pill for 3 days and then come off. But that means they are prone, to having fluid overload. That's what it's called when those ankles swell up like that. I mean, you're retaining too much fluid. It's okay. But if you're going to go out, believe me, it's better to take it prophylactically and be preventive than to go out and then try to come back home and take it. Think about it. If you take a medication for your blood pressure and you take it sometimes when you check your blood pressure, this is the time you need to take it. This is the time you need to take care of your heart and your brain and everything else, because you might need it and you don't want to be, even if you are 3 houses away, the ambulance might come first than your wife or your brother or sister with them pills. So try to go over your medication, your regimen, if you're going to go out, and make sure that you do take it. And having said all of that, there are many people out there that are lonely, that they spend the holiday by themselves, and they will be sad more than usual. And there are many things out there that they can do. There's many programs on TV. I love to watch the PBS channel. They have beautiful programs during the holidays. And when I'm by myself, I just watch PBS and watch one of those nostalgic shows and stuff, and enjoy myself, open a bottle of wine, and sit down and try to make the best out of it.
I think that if they're lonely, they should come see you.
They should come and see me. Let's all of those lonely people get together and have a party.
You're going to have a Lonely Hearts place at the Adult and Geriatric Institute. I have to wait. I have to do this. I just have to. You're listening to Dr. Andy Mencia, and he has fantastic. I don't know. Everything about him is very special. Not only is brilliant as a physician, but he's got a heart is so big, and you're just going to love everybody at his office.
I'm going to cry.
And it's called the Adult and Geriatric Medical Center. It's over there on East Commercial Boulevard near Holy Cross. Let me give you a phone number, and they are open on Saturdays. Don't wait till you really have some serious problems. Go see him now. You're going to enjoy it. It's the first time I have to tell you, if you want to go to a doctor, you're going to have fun. You're going to enjoy him. Not only is he going to take care of you. It's 954-489-1345. 954-489-1345. You can also go on the website, which is adultgeriatrics.com. You can, I have to just tell you something, that he has the most, I don't know if I want to call him beautiful, but they're so simpatico, the people that work there. So everyone is so lovely, and it's really an adventure to go to your center.
I was talking to them during the holiday parties that we have yesterday at the office, and I was telling them, to me, they are my family, and I say, I was telling them I'm so proud that they are there, and they work so hard. And even one of the guys said, Dr. Mencia, I never thought that my work will impact other people, because I was telling them, in any company you work really hard, that you don't work for the money. You work really hard because it's your ethics. You open the door to other people. And my rule is that if you work your butt up really, really hard, every person that will do that will create 10 jobs to other people. So imagine if all of us as Americans start working really hard, start creating jobs for other people, we won't have the problem that we're having right now.
That's true. Big
we
problem.
don't need to depend on other people to come and rescue us economically. I think we can do it ourselves. We just need to believe in each other and get the work done. And my staff, they really believe in themselves, and they know how they work like a team.
Well, but it's your knowledge. I mean, you are really, you are so knowledgeable about so many things, and maybe it's the time to talk about my knee.
Let's talk about your knee. Well, the other thing about seeing doctors, before we leave the topic, is that remember that during the holidays, a lot of people will close for the holidays. So they are closed. So if you're trying to get to your doctor, you won't be able to get in there. We have a live person responding our phone. And, today is Saturday. We are open. A lot of offices are already closed. Forget it, whether holiday or not.
They're closed at 3 o'clock on Friday. Are you kidding?
And they go for a long holiday. So, Christmas is Tuesday. So a lot of people taking a, long weekend off. And all the people that I work with, senior helper and the home health care agency that I'm working with, they are all have to be open because I'm open. So they have to be there with me, otherwise I kick them out. So, is make sure before the holiday, if you need medication, if you need anything, make sure you get seen. Don't go to an emergency room, to an urgent care center. They don't know you from a hole in the wall. You know, I see so many people that come to me and they went to an urgent care center and they got a drug for whatever. And they didn't look at the entire list of medication and the drug-to-drug interaction and the harm that this thing can be doing to them. And they did it trying to substitute whatever the person needed at the moment.
But isn't it better than going to an emergency room if they can't get a hold of something? Yeah, is that not better for something simple like a cold or something? Well,
look at the guy that came to say. Look at the captain.
But you prefer people to go to emergency rooms?
If
what is the differentiation? It's a good thing to discuss.
Between an urgent care and an emergency room.
Yeah.
Yes, the emergency room is more for emergency. The urgent care center is for urgent need. And to me, an urgent need is I'm traveling and I have a wound and I need that to be clean and taken care of for one time and then I'm leaving. Or I have a high blood pressure and my blood pressure I check in the pharmacy and it's not coming down. I just need a doctor to check me and make some adjustment of what I already have. Urgent care is not to be for making a lot of changes on a person's life because, you know, I have patients that are established with me. I have one of my patients that was going to California this week and he wanted to change one of his medication. And I told him, no, until you come back from California, I don't want to do it because I want to follow you up to make sure we're doing the right thing. So I said, oh, that makes sense. So, you know, he's going to California. When he come back, we'll make the change so I can monitor my patient. Even if I had to see that patient every other day, every week, at least I'm there for that patient to come right back to me if there is a problem. And when you go to an urgent care center, you know, you go to a place they don't know you. And they draw all this blood and they do all these things for when you're having high blood pressure. They might want to do x-ray, do this, you know. So it's blindly getting you, treating you for things that you have, that if your doctor is available and you have a choice, just walk into your doctor's office. Sometimes, you know, it's with the technology and all of that, it's hard to get a hold of the doctor. You know, yesterday while we were having the party, I went downstairs to the front desk, and by mistake, the phone was ringing downstairs instead of upstairs.
So you were
Thank God I was
them.
there, and I responded the phone, and I solved the problem. But things like that happen. So I can imagine people calling and nobody answering during my Christmas party, and I say, "Oops, let's fix this problem." So with technology, things will happen. But I always tell my patients, we are there 6 days a week. If you have a problem, you don't hear the operator, just come in. And, everybody gets in. Thank God, we are at the point that we can still see everybody. You might have to wait a little bit longer than usual because it's not through a actual appointment. But regardless, if we see people that come in and we see that it's an urgency, then come in. When to go to an emergency room? When it's a true emergency. If you're having chest pain and the chest pain is going down your left arm, or if you're having a mini stroke or anything like that, the sooner the study have shown that the sooner you hit that emergency room, the sooner, the less time that you waste, the better the chances of recuperating from that event. So there are places for an emergency room. Emergency room is not a place to go because, I had a patient who was an EMS, and he was cracking up because I was an EMS in South Florida, and I will get phone call from the assisted living facility, and some of the lady call, and why do you call him, ma'am? I cannot tie my bra. Can you help me? Call 911.
Well, that's what
and they will have a laugh.
Right, of course. Yeah.
Should we check your blood pressure? No, don't touch me. Just tie my bra. Get out of here.
Right. But a lot of times you call a doctor's office and they'll say, Do not leave a message if you're having an emergency. Go call 911. They all say that.
Yeah, it's by law.
Is that what you have to do that? Oh, I didn't know, because every time
because,
you go,
if it is a true emergency, don't sit on that phone waiting for somebody to answer. Just call 911 if it's a true emergency.
Right.
If you don't think it's a true emergency, then call the doctor. Come to the doctor.
But something that you said that's so true, that you are available.
Yes,
you
let's
are
talk
available.
about your knee.
Oh, my knee. All right. Talk about my knee.
It's a good thing. That your mistake is mistake that people make out there every day.
Let's talk about that. Okay.
So you damage your knee.
Yeah, my knee hurts.
And your knee hurts.
And instead of calling you,
it got swollen.
I knew an orthopedic surgeon.
Instead of calling me, you call this orthopedic surgeon that you know, but he doesn't know you as a patient.
No, he doesn't.
And he took an X-ray.
Yes, he did.
And he told you, your knee looks beautiful.
Yeah, everything's beautiful. So the thing that you must have is a torn meniscus, right?
So let's start some. Yeah, the thing is, like, when you go to your doctor, you go to your prime, even if you're having any problem, the take-home message for you and everybody out there is that you might be having, forget about the knee, let's talk about the heart. You can be having like a little chest pain. And
in
you
my
might
knee?
say, no, you can be having a little chest pain, and you say, let me go to a cardiologist. Run to a cardiologist. The cardiologist doesn't know anything about how your thyroid is doing, how your kidneys are doing, and your heart doesn't walk around by itself. And your right knee that is hurting you doesn't walk around by itself. It's attached to your body. So what we need to do in that case is, the X-ray, I will tell you that it won't show me anything. I would not even have wasted the time with the X-ray. But if you went to an orthopedic, that's why he or she is going to do an X-ray. The MRI is the way to go, and the physical examination. Sometimes with the physical examination, we can make a very good determination of what's the stability of the knee. Why do you want to make sure that you get to the bottom of your problem before you start going through, this orthopedic doctor who is a good doctor who you went to, and then start going through physical therapy? You need to get to the bottom of your problem. If it's a torn meniscus, and let's say it's 80% torn, maybe physical therapy is not the indication. You might not want it might harm you to do physical therapy, and you might want to put a lot of ice and rest that joint until the swelling come down. So you have to, your primary care doctor, is supposed to be a clinician. That's what we are. We are clinician, and when a person comes with one joint aches, we do a full workup, make sure there's no gout going on. If you tell me, well, I went with Bill and we ate a lot of red meat and we drank wine, and 5 years, 10 years ago, I had gout, and it might be a flare of gout. Let me treat you, let me work you off for gout before we do anything. So, you want to go through a differential diagnosis of what bothering you before you go and start blindly doing physical therapy, and now you were telling me you put heat because heat tend to make you feel better. But in reality, yes.
Well, I
yes.
had. No, wait. No, wait. I did use ice. I did use ice when it first happened and all that. But you know what?
About the heat.
But then I went and put heat on, and heat felt much better. And everyone has
Every
said
time
from
you're talking to a woman, they're going to say yes, but they go through such a rigmarole that by the time they just come out.
But I did do it.
So
but
yes.
and what they said, everybody has said that you should use heat if it feels better compared to the ice.
No, you want to use ice because you want to decrease. Because I saw your knee now. Before we went on, I look at your knee. Bill, I'm sorry. I look at your knee.
Yeah,
and
it is swollen.
It is swollen. So ice is the way to go. You want to ice it.
Okay.
And you want to, and I know you're working a lot. And sometimes you might want to even put a brace on it so that you can work and rest. There's a way of, there are braces that will protect your knee.
Someone told me about that.
And you can still work. You can be active, but your joint is resting.
Okay.
So... that's why a good clinician is so important in a case like you.
You have convinced me.
Okay, so everybody out there, people go there and say, oh, I'm having this, I'm going to see a neurologist. I had a patient, this is a good one. I have this patient, health insurance told her she's insistent in the emergency room. She went to the emergency room because she was having numbness on one side of her body. That was her description. And they did $1 million workup. Yeah, they did the $1 million workup. Okay, and when they finish the workup, they say, if the emergency room doctor say, you can see a neurologist, and they gave her the name of the neurologist. Are you with me? Mm-hmm. They gave her the name of the neurologist, and the emergency room doctor. Why don't you go and see Dr. Mencia first? Because I see in your insurance he had been assigned to you as your primary, and the emergency room doctor highly recommended to come and see me first before seeing the neurologist, even though it was numbness on one side of the body. When I saw the patient, what she had was a entrapment of the nerve right above the behind the shoulder. So I injected her that same visit because she said, "Can you make me feel better today?" And I said, "I can definitely try." So I took and I injected her, and I told her go home and put some ice on the site where I did the injection. And she came yesterday to do the blood work, and I said, we set her off with a neurologist. I said, let me take care of you first, but I don't think you need to see a neurologist. You might need to see my orthopedic doctor instead. But I did the initial injection to give her some relief, and she said, the pain that I was having to the left side is all gone now with what you did. The numbness still there, but it's not that bad. I think that's getting better. And that was like 2 days after the injection. So lots of time before running to a specialist, go to a primary care doctor, somebody that knows you, that can think of you from head to toes, left to right, understand your entire body and your biopsychosocial situation before you run into an orthopedic. And the other thing is that sometimes going to a specialist can be very expensive. The copay and all of that stuff can be a lot. So if you have a good primary care doctor that can take care of business, why go and spend that money so quick? The last thing of what you did wrong is that if I'm going to send you to an orthopedic, I have done all the workup. So by the time you go to that guy, he's going to be so happy because he has everything in front of him, and he can tell you with certainty and say, Anita, this is a torn meniscus. You're going to wear the brace. That's up today.
It's fantastic. Well, no, this is a.
It's a learning. It's
no,
a good
this is a wonderful
experience.
thing that you have shared, because as smart as I thought I was with a lot of things, I thought about calling you. I said, well, why am I going to bother you with this? Because it's obvious it's my knee.
Big mistake.
You're right. It was a big mistake, and I won't do that again. You're right.
Yeah.
Oh, everyone's now boo, 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 boo. I'm getting bad things from everybody.
No, it's a good thing because
No.
you're teaching so many other people.
Okay,
You
that's
are
right.
teaching so many other people of what not to do. And we all make those mistakes. So many people make those mistakes.
Right. And so now I'm going to be very, this is a good thing to say. So go to Dr. Mencia first.
I had
him
one of my patients that suffered from migraine. And been to a couple of neurologists and still see a few neurologists. One is just a migraine neurologist. And get this horrible migraine that nobody can break. And sometimes really, devastating. And I say, well, there's one treatment that I heard of that seems to work very well. Why don't we try it? And now she loves me. She say,
It's
she does
helping.
it all the time. She say, for now, this is helping me. This is working good. So, you never know. Sometimes my philosophy is you have to work in conjunction with the specialist. And that's why I try to bring all of the specialists into the center, because the main problem with medicine today is communication. People are not communicating with each other. And, that gap opened the door not only for lawsuit, but for poor care. And we need to do better care for our patients.
I really appreciate that we had this discussion. I mean, I really did, and I know we've gone over a little bit.
We went over a little bit.
I know that, but it's very important. I think the whole message is
954.
he loves to give his phone number.
954.
I know. Next year he get his weight and his height and everything else. Maybe he could just start giving numbers out.
Yeah,
What's your phone number?
954. 489-1345.
Okay, and I'm going to do it one more time because
I'm going to say it in Russian.
It's 954-489-1345. Before we go, why don't you say something to your mother since she's listening in Russian?
Мама, доброе утро. И пользуясь случаем, я хочу сказать всем русскоговорящим, всех поздравить с наступающим Рождеством и Новым годом. Happy New Year and Merry Christmas.
Oh, yes. And then in Hawaiian, we say,
in Hawaiian.
Meli kaliki maka,
Okay.
haoli makahiki hao.
And what is that?
Merry Christmas and a Happy New Year.
Thank
Sound
you
Russian
very
to
much. That sounds like Russian to me, exactly. Okay, well, we have a wonderful woman calling in now from the Boynton Beach Senior Center. They're going to be doing something really special. Thank you very much.
My pleasure.
And I will be calling you.
Thank you.
Okay, now I'm a mixed up lady here.
A woman calling you from the senior center.
Oh, yeah, right. Nancy Molina.